It has been a long, hard road with the COVID-19 pandemic, but even after all this time, a massive mystery still sits right at the very heart of it. In this explainer, we're going to break down the official scientific investigation that's trying to find out where it all began. Welcome to Infectious Diseases TV. We share useful information about infectious diseases. And let's be clear, the stakes here are just staggering. The World Health Organization estimates the real human cost is at least 20 million lives. A number that big tells you that getting answers isn't just a scientific curiosity, it's something we absolutely have to do. So that leaves us with the one big question that's been on everyone's mind. Where, and maybe just as importantly, how, did this virus first make that jump into people? You know, this isn't about looking back just for the sake of it. This is a real, live, unsolved global mystery. And finding the answers is absolutely crucial if we want to prevent the next pandemic. So, who's on the case? Well, the WHO put together this team, a group of independent international experts from all over the world. They go by the name SAGO, and their entire job is to cut through the noise and figure out, based on science, how this crisis actually started. Okay, so SAGO's whole investigation really boils down to two main ideas, two primary hypotheses that they're digging into. All right, so let's break those down. On one hand, you've got the natural origin theory. This is the idea that the virus spilled over from an animal, like a bat, maybe through another animal that was sold at a market. Then, on the other hand, you have the laboratory origin theory. This one looks at the possibility of an accident, a slip-up related to research or a failure in lab safety. SAGO's job is to look at the evidence for both, with no thumb on the scale. All right, let's dive into that first path, the natural spillover idea. And it's important to know, right now, this is the one that most of the available science seems to be pointing to. So where did the clues first lead? Well, the early data pointed a huge flashing arrow at one place in particular, the Huanan Seafood Market in Wuhan. I mean, think about it. The very first known case, back on December 1st, 2019, linked to the market. And before 2020 even started, a whopping 55% of the first known cases were tied directly to this spot. That's a pretty big signal. Okay, now this is where the clues get really, really interesting. When investigators went through the market, they found the virus itself everywhere. 73 samples from drains and stalls tested positive. But here's the kicker. They also found the DNA of animals that we know can carry this virus, like raccoon dogs, mixed right in with those positive virus samples. So you have the virus and the potential carrier in the exact same place at the exact same time. But, and this is a big but, after the market was shut down, no virus was ever found in any of the animal samples they tested. So we're close, so close, but we're missing that final smoking gun of an infected animal. And, this whole idea fits a pattern we've seen before. Coronaviruses, they often come from bats. Scientists have found viruses out in nature that are super similar to SARS-CoV-2 in bats in both Laos and China. Now, they're not a perfect match, not the direct ancestor, but it proves this type of virus is out there. And this isn't new, right? SARS jumped from bats to civets to humans. MERS jumped from bats to camels to humans. A natural spillover isn't some crazy new idea. For coronaviruses, it's a well-worn path. So, when SAGO puts all of that evidence together, what's the verdict? Well, they conclude that a natural zoonotic origin is the best supported hypothesis we have right now. But, and this is super important, they also make it clear that it's not a closed case. Until more pieces of the puzzle show up, the final origin story is going to stay inconclusive. Okay, so that's one path. Now let's switch gears and look at the other line of inquiry, the possibility of a laboratory incident. Now this is where the story gets really different. If the natural origin path is all about the clues investigators do have, this path is defined by what they don't have. The single biggest challenge here is a huge, frustrating lack of critical information. Yeah, this quote from the SAGO report really says it all. They're basically saying, look, our hands are tied. Without access to key data, it is simply not possible for them to properly assess this hypothesis. They can't confirm it, but they can't rule it out either. So you're probably wondering what information is missing. Well, SAGO has asked for pretty standard stuff from the labs in Wuhan. Things like their biosafety procedures, any safety audit reports, health records for the lab workers from back in 2019. This is the basic information you would need to either identify or rule out a lab incident. And because it hasn't been provided, this hypothesis just has to stay on the table. So here's the bottom line on the lab hypothesis. It remains an open question. And that's not because there's a pile of evidence pointing towards it. It's because the lack of access to essential data means a proper scientific evaluation just can't be done. It's a possibility that can't be proven, but it can't be disproven either. So after everything we've been through, you might be thinking, why does finding the origins still matter so much? Why keep digging? Well, the answer is pretty simple, and it's all about our future. This quote from the SAGO report just hits the nail on the head. This whole investigation is not about assigning blame. It's about understanding what happened so we can put the right strategies in place, whether that's better monitoring of wildlife trade or stricter global biosafety standards, to make sure this never, ever happens again. It really is about saving lives. So the work to find the origin of COVID-19 remains unfinished. And as long as crucial data remains just out of reach, this fundamental question is just left hanging in the balance, leaving all of us a little more vulnerable to the next threat that we might not see coming.
This is Infectious Diseases TV. Please like and subscribe.